You know it, I know it, everyone knows it. Prescription drug prices in the United States are brutal. Now, there's a brand new federal website called TrumpRx that says it can help Americans pay way less for their medications. No insurance maze, no pharmacy middlemen, just direct access to discounted drug prices. So you might be wondering, what exactly is TrumpRx? How do we get here? And is this a real shakeup in drug pricing or just another political headline? Well, first, let's clear something up that's important. TrumpRx does not sell prescription drugs. Instead, it's a government-run portal that lets users search for discounted prescription prices and then either click through a manufacturer direct-to-consumer site or download pharmacy discount coupons. The program, by the way, is aimed primarily at uninsured Americans and people with high deductible health plans. These are really the groups that feel the full sticker shock of drug prices in the United States. At launch, the site listed more than 40 medications, including high-cost drugs for diabetes, weight loss, cholesterol, and fertility. Now, you're probably wondering, how do we get here? Because TrumpRx did not appear out of nowhere. For years, the United States has faced criticism for paying far more for the same drugs than other developed countries. In response, the Trump administration revived a policy idea known as most favored nation pricing. The concept, by the way, is pretty simple. If another country pays less for a drug, Americans shouldn't pay more. In late 2025, the White House announced TrumpRx as a way to operationalize that idea. By negotiating directly with manufacturers and posting those prices publicly, it was Trump's hope to be able to bring down drug prices for the average American. The rollout, by the way, was delayed amid legal and congressional scrutiny, but TrumpRx officially went live in February 2026. And as you might have guessed, this maneuver by the White House with TrumpRx has received mixed reactions. Supporters, on one hand, say it increases transparency, pressures drug makers to compete, and gives uninsured patients real alternatives. Critics, on the other hand, are raising several concerns and honestly have a couple questions. They're saying many insured patients may already get equal or better prices through insurance. They have questions about oversight, conflicts of interest, and even legality. And they also have a question about whether this actually addresses the structural causes of high drug prices. Now, some pharmaceutical companies have also warned that deep discounts could hit revenues, which tells you that this initiative is changing the negotiating dynamic, even if it impacts are uneven. But there's some part that's getting far less attention, and this is the business opportunity. Because TrumpRx isn't just a healthcare story, it's a business ecosystem. Opportunities are emerging across the gamut. For instance, health tech companies building price comparison, navigation, or compliance tools, manufacturers and distributors adapting direct-to-consumer models, consultants and government contractors supporting implementation, audits, and oversight, data and analytics firms tracking pricing, utilization, and outcomes. Remember, anytime the federal government creates a new platform, an entire secondary market forms around it. And here's the bottom line. TrumpRx won't magically fix America's drug pricing problems, but it does signal a shift toward transparency, direct pricing, and aggressive federal involvement. Whether it becomes a meaningful solution or political footnote will depend on execution, expansion, and who steps in to build around it. And that may be where the real story is just beginning, at the building of the ecosystem. If this helped you understand TrumpRx, what's happening, and even some of the business opportunities there, please make sure to hit subscribe, like, share. If you have any questions, any comments, put them below. We try to respond to every single comment as it comes in. Thanks for watching. See you next time.